There's a lot of stuff that really doesn't work. Now, some people will claim a tricky thing to treat, which can lead to, hey, good optometry morning. Have you ever wondered why your eyes are itchy or irritated or burning, and they have those little flakes on the eyelashes that you just can't get rid of no matter how much you clean them? The culprit could be something called a Demodex mite, and it should be your very best friend, but it could also be your worst nightmare. Hey, so in this video, I'm going to explain to you the good, the bad, and the ugly of those pesky Demodex eyelash mites so you can know what to do in case you need to get rid of it. So Demodex is a mite that lives on the skin of mammals. It means that it survives by eating dead skin, bacteria, and oils that are on our skin. Now, Demodex is a normal part of our microbiome, and it's supposed to be there, and it does a great job for us in getting rid of some of those excess oils and cells and bacteria that's not supposed to be there, as long as it doesn't get out of hand. And if the numbers of Demodex stay low, they're perfectly harmless and don't cause any symptoms at all. So I want you to think of Demodex as having kind of teenagers in your house. So if you have a couple of your own teenagers in your house, they're great. They're good to have around. They're fun. You love them and you like them being part of your family. And there's not a problem. But if the environment is just right, let's say there's the right type and right amount of food, there's good beverages, there's a good environment, like maybe some music, maybe the environment, the parents are away, maybe it's late at night. Some other teenagers might find out that your environment in your house is really great for teenagers, and they start showing up in more numbers than you need. And if you have more teenagers in your house than you're supposed to have because the environment's so good, they can throw a party and things can get out of hand really bad and cause lots and lots of problems. And that's just what it's like with Demodex. If the environment's right on our lids and our lashes, you can get more of them than you need, and they cause a lot of problems. Now, there are about 65 different types of Demodex mites that live in our world, but there are only 2 that live on our lids and lashes. And in fact, there's actually only 2 that live on humans. And these 2 I'm referring to as the Demodex duo. And basically, one of them is called Demodex folliculorum, and the other one's called Demodex brevis. And Demodex folliculorum, they live around hair follicles, which include the eyelashes. And Demodex brevis, they love to live in sebaceous glands like the meibomian glands in our upper and lower eyelids. Now, like I said, there's lots of different types of Demodex mites, and pets will carry them as well. And in fact, you may have heard of a condition called mange in dogs, and that's actually caused by a particular Demodex mite that only lives on dogs. But don't worry, those Demodex mites can't transfer to humans, and likewise, the Demodex duo that lives on humans can't transfer to your pets. So this Demodex duo that lives on our body can live anywhere on our skin. And so that's why these will be referred to as either eyelash mites, maybe skin mites, or maybe even face mites. But I'm going to be specifically talking about how they affect our eyelashes and our eyelids. All right, so what do these Demodex mites look like? Well, they are super, super tiny. They are about 0.2 to 0.4 millimeters in length, and they are a cigar-shaped organism with 4 legs, and they have a transparent body. And so they're almost impossible to see unless you have a high-powered microscope that you can look at them. And even the microscopes that we use in the clinic to look at the surface of your eyes, most of them don't have nearly enough magnification for us to detect or see a specific Demodex mite. So I'm going to talk about who has Demodex mites in a moment, but let's talk a little bit about their life cycle. So Demodex don't live very long. They only live about 2 to 3 weeks, and it takes about 3 to 4 days for them to hatch from their eggs, and then about 1 week to become the adult form. And then for the next week or 2, they basically spend that time eating and mating, laying out their eggs, and then they die. So interesting things about Demodex, they move extremely slowly. Basically, they move their rate of 16 millimeters per hour. So very, very slow moving. They mostly live in and around the follicle, but they go in and out of the follicles as well as the oil glands of our lids, and they are most active at night. Now, one interesting thing about Demodex is they don't poop, but they do molt and shed some of their skin, and they can also excrete some enzymes which help them digest some of the food that they're trying to eat. And these are going to cause all sorts of symptoms. But before we get into that, let's talk about who might actually have Demodex. What we know is that newborns and babies often don't have Demodex on the surface of their skin, but we get more of them as we get older and older. Another interesting thing is some studies have shown that there are some certain populations, particularly those that are very remote and not in urbanized settings, that don't have any Demodex on their skin. Studies have shown that about 2 to 27% of those in our 20s and 30s will have some amount of Demodex on our eyelashes and eyelids, and 80% of individuals over 60 will have Demodex on their eyelids and eyelashes, and 100% of those of you over 70 years old will have Demodex in and around their eyelashes and lids. So if I go back to our teenager analogy, if Demodex get a little bit out of control, they love to throw a party. And when that happens, we call it Demodex Blepharitis, or DB. And like I said, those are going to cause all sorts of symptoms we're going to get into right away. But about 50 to 60% of the North American population will have some amount of Demodex Blepharitis. Now we know that Demodex is going to love certain environments and certain types of people. So they love to live on people that have oily skin, and they're more prevalent in people who have diabetes. And we know that people that have cataract surgery will often have an increased amount of Demodex. We know that stress can increase the amount of Demodex. We know that people that are immunosuppressed or who are on immunosuppressants will more likely have Demodex Blepharitis. And we know that increased alcohol take and smoking will both increase the amount of Demodex that you have on your eyelid. We know that Demodex Blepharitis is more associated with those with rosacea, meibomian gland dysfunction, dry eye disease, and styes. And when Demodex mites start to have a party, they can get really out of hand, and you can get up to 25 Demodex mites in each gland or hair follicle. So when you have the normal amount of Demodex mites in and around your eyelashes and eyelids, you're not going to have any signs or symptoms, and you won't have any problem at all. But if you develop Demodex Blepharitis, you're going to have lots of symptoms. So you're going to often get itchy, irritated red lids, and the surface of your eye can also become red and irritated. And this is often from the molting of the Demodex mites. They're from some of the enzymes that they release to digest their food. They're from the waste products of dead Demodex mites that die on the surface of your skin. And they're also a lot of waste products that are produced when the Demodex are eating skin cells, bacteria, and the oils. And these will accumulate in and around your lids and lashes, and they can also fall into the surface of your eye, on your tears, and cause inflammation in and around your eyes. Now, one sign that we can absolutely see, and this is the way that we diagnose Demodex Blepharitis, is that we'll see these little collarettes or flakes of debris that are right at the base of the eyelash, and those are a hallmark sign of having Demodex Blepharitis. Now, some people will claim that they can feel Demodex moving around on their eyelids and eyelashes, but like I said, they move so slowly and they're so microscopic that you're not going to feel these moving on your eyelids. So if you think you're feeling that, it's just psychological. You're not feeling those bugs moving. But we know that these bugs can damage and irritate the lashes of our lid. They can cause your eyelashes to grow in different directions. They can even cause your eyelashes to fall out. And Demodex can clog and block and inflame your meibomian glands, which can lead to meibomian gland dysfunction. And I've got a whole video on that up here, which can lead to dry eye disease. And that dry eye disease caused by Demodex Blepharitis will cause you a foreign body sensation. It can cause your eyes to be more watery. It can cause you to have blurred vision, and it can cause your eyes to be very sensitive to light. And Demodex Blepharitis can also cause you to get more frequent eye infections, including styes in the eyelid. So I'm going to tell you some of the things that do not treat Demodex in a few moments. First, let's dispel some of the myths that are out there about Demodex mites. So number one, Demodex mites are not contagious. So that means if you share a bed or a pillow or towels or touch surfaces that someone with Demodex Blepharitis has, you're not going to contaminate yourself and give yourself Demodex Blepharitis. Again, if we go back to our teenager analogy, if your neighbors have a crazy party of Demodex teenagers because they have the perfect environment of food and beverages and entertainment and whatnot, but you don't have that same environment in your home, those Demodex teenagers, they're not coming over to your house to infest your home unless you have the same environment as over there. Now, in theory, you can transfer Demodex mites from one person to the other directly. But that's only going to happen if you're taking your hand and rubbing someone's eyelid and then take that same hand and rub your eyelid. You're probably going to transfer some Demodex mites to your eye. But if you don't have that perfect environment for them to thrive in, those Demodex mites that are transferred, they're not going to thrive and be overrun, and they'll probably die relatively quickly. Now, if we talk about where Demodex can live, they can live in makeup. So if you have a Demodex blepharitis and you're using makeup, then that Demodex can be transferred into your makeup. So it's probably a good idea not to try to share your makeup with other people. And like I said, Demodex mites can't be transferred to or from pets because they're different organisms that don't live on both species. So Demodex blepharitis can be a tricky thing to treat, and there's a lot of stuff that really doesn't work. So we know that 75% alcohol, which is often what you use in alcohol swabs, those will not get rid of Demodex mites, and you're not going to be wanting putting those in and around your lids because that's going to burn like crazy. Likewise, we know that 10% povidone iodine, which is commonly used to disinfect the surface around your eyelids, particularly before surgery, we know that that will not kill Demodex mites. Likewise, any cleaning or disinfecting wipes are not going to have any effect on treating Demodex. As well, oil products like olive oil, vegetable oil, anything like that is not going to have any effect on getting rid of Demodex mites. And we know, because Demodex mites are not bacteria, that antibiotics like erythromycin will not kill Demodex mites. Sometimes when people think of mites, the image that comes to their head are actually going to be ticks, fleas, or maybe even lice. And because mites are different than all of those other organisms, they're not going to respond to the same type of treatment. So treatments for fleas, ticks, and lice are not effective treatments to treat Demodex mites. So that includes smothering your eyelids with Vaseline. That's not going to really have much effect on Demodex mite. Likewise, shaving your eyelashes or shaving your eyebrows are going to have no effect on getting rid of Demodex mites, but that definitely will make you look really goofy. We know that shampoo and washing in and around your eyelids isn't going to get rid of Demodex blepharitis. Now, I've got a whole nother video about bacterial blepharitis, which a lot of people will have as well. I'm going to put that down in the description below. And all of the treatments that you might use to treat bacterial blepharitis are going to have no or little effect on Demodex blepharitis. And for that reason, a lot of times some patients, they're diligently treating their bacterial blepharitis with all the things that their doctor has given and recommended, and they're finding that, hey, my blepharitis is not getting better. And that also could be a hint that this might actually be Demodex that's causing the problem and not bacteria. So washing and scrubbing around on your eyelids are some of the in-office treatments like Blephadex, where they're scrubbing around off on the lids. Those things are going to be good at getting some of the waste products that are causing some of the irritation. So they're going to help with some of your symptoms, but they're not going to have any effect of actually getting rid of the Demodex mites themselves. So they'll help a little bit with the symptoms, but won't solve the problem completely. And likewise, anything that kills bacteria, which will include antibiotics, but it can also include something called hypochlorous acid spray, which is something that we use to get rid of bacterial blepharitis. Those will kill the bacteria that are living around our lids and our lashes, which some people say, well, that's going to help Demodex blepharitis because the Demodex eats bacteria and it's going to take away some of their food source. However, Demodex have a lot of different food sources, which include bacteria, but it also includes the oils and the skin cells. So Demodex have lots of other food sources if you get rid of the bacteria. So those treatments that are dealing with the bacteria, not going to get rid of Demodex mites. But there are some things that are very effective in treating Demodex blepharitis. And if you want to learn about those, you need to watch this video right here. And with that, have a great optometry day.